Hi, my name is Michaela Reed, and I'm in Professor Gleckler's lab class from 10:20 until 12:10, and today I'm going to be doing my skills test 2 assessment. So the first thing I'm going to do is I'm going to use a Sani wipe, which is imitated by these wipes here, and wipe down my examining table. And then I'm going to wipe down my stethoscope with my alcohol swab. And now we're going to begin the assessment. I'm just going to have my patient. And I can just have you sit on the edge of the examining table. So hi, my name is Michaela. I am a student nurse from Nu210, and today I'm going to be doing an assessment on your pupils, on your abdomen, and on your lower extremities. Before we begin, can I have your full name and date of birth?
Lori Ann Reed, 2/28, 1967.
So the first thing I'm going to do is the Perla test. This is where I'm going to shine a light in your eye, and I'm going to see how your pupils react. If you can just focus on the blinds behind me. I'm going to do it twice in each eye. Over the shoulder. And then the next thing I'm going to want you to do is just stare at the end of my pen tip and just follow it in as it comes near your face, okay? Perfect. So the pupils were equal, round, and reactive to light, both directly and consensually with accommodation. So the next assessment I'm going to do is on your abdomen. Before we begin, have you emptied your bladder in the last 30 minutes?
Yeah.
And do you have any pain in your abdomen?
No.
Okay, then I'm going to have you lay right here. Just going to open this up. Just right. And if I can just have you push yourself just a little bit. Perfect. So the first thing I'm going to do is I'm just going to inspect your abdomen, okay? So the skin tone of the abdomen is even and consistent throughout. It is also consistent with the patient's ethnicity. There are no lesions on the abdomen. There are maculas in both the upper right and left quadrants, and there are striae in the lower right and left quadrants that extend up into the upper left and right quadrants. There is a macula here that is brown in the center, surrounded by a erythematous circumscribed surrounding and a slight erythematous spot there. There are also some marks here that seem to be from just the patient's shorts. Just gonna lift this up a little bit more. So the contour of the abdomen is rounded. And if I can just have you hold your breath real fast. Okay, let it out. And the apical pulse was present. Okay, and then the umbilicus is midline and inverted, and there are no piercings within it, and there are no tattoos over the stomach. So the next thing I'm going to do is I'm going to listen with my stethoscope or oscillate your abdomen. Okay. there were positive bowel sounds in all 4 quadrants. And then the next thing I'm going to do is I'm going to palpate the abdomen both lightly and deeply. And you said there was no pain, right? Still no pain? Okay, so the first thing I'm going to do is light. I'm just going to repeat the upper left quadrant so that you can see what I am doing. Okay. So there were no masses or lesions within the stomach, and the muscle was smooth, firm, and consistent throughout the entire abdomen, and there was no pain or tenderness upon light palpation. So now I'm going to do the same thing, okay? I'm just going to go deep, do deep palpation. So upon deep palpation, there were no lesions or enlarged organs. There were no masses that felt, but there might have been some harder tissue. I wouldn't say they were nodules, but some harder tissue in the lower left quadrant. And there was no pain or tenderness upon deep palpation. Okay, so we're all done with the abdominal assessment. So now I am going to do an assessment of your lower extremities. Have you had any pain or tenderness in the lower extremities?
No.
No? Okay. First thing I'm going to do is I'm just going to inspect. So if I can have you, place both feet flat on the ground. Thank you. Or on the examining table. So both of the lower extremities, the skin tone is even and consistent throughout both lower extremities and is consistent with the patient's ethnic background. Both lower extremities are also equal in size and shape. There is some calluses right on the patella and inferior to the patella with some darker brown discoloration. They almost look like dry patches on both extremities. There are some varicose veins on the right extremity and macula on both extremities, and some varicose veins on the lateral side. On the lateral side of the left extremity. and also on the lateral side of the right extremity. Underneath the left extremity, there does seem to be a red spot with a papule, a brown papule around it. It is red and a birthmark with also some more varicose veins. And there are also some varicose veins on the medial side of the right lower extremity. The calves of both lower extremities do seem to be a little dry. And there are 2 erythematous spots, one that is with a scab on the right lower extremity. I will say there is slightly a darker tone on, so the skin tone is consistent, it's just slightly darker on the feet, mostly because of probably tanning of the feet, even though there isn't much sun outside. However, that is not abnormal. And there were also some striae underneath both of the legs, right on the calves. Okay. So the next thing I'm going to do is I'm going to palpate for temperature, okay? Yeah, so the temperature was consistent throughout both lower extremities. It was warmer more proximally and became cooler distally. Okay, so the next thing I'm going to do is I'm just going to palpate your legs for any masses, okay? There are no masses or lesions in either one of the lower extremities. Okay. And then the last thing I'm going to do is I'm just going to check for some edema, okay? You know what? I'm not going to use gloves. There is no edema present on either one of the lower extremities. So the next thing I'm going to do is I'm just going to do 4 of your peripheral pulses, okay? So the first one I'm going to do is femoral. Yep, if you can turn your legs out for me. So for the femoral pulse, it is 2 plus symmetrical. The next one I'm going to do is the popliteal. So I'm going to have, you can extend this side out straight and just keep that foot out there. So I'm just going to come underneath this surface is where I would feel the popliteal. Okay. I'm just going to check the skin. So I was unable to palpate either one, but both have pink undertones and are warm temperature. So I would have another nurse double check my pulse, or I would use a Doppler. So the next one I'm going to do is your posterior tibial pulse. gonna come around so it's a little easier for me. So I felt 2+ on the right posterior tibial pulse. I was unable to find the left posterior. However, it is warm and pink undertones. So I'd ask another nurse to just assess this side or use a Doppler. So the last one I'm going to do is your dorsalis pedis. Okay. I would say that they were 1+ symmetrically. All right, so the last thing I'm going to do, I'm just going to do an assessment of your feet, okay? For this, I'm going to don gloves. And no pain in feet, correct?
Correct.
So the skin color is even throughout the feet. As I had mentioned earlier, it is slightly darker than the rest of the extremities, but that is not abnormal. It's not hyperpigmented. There are calluses on the plantar surface of both feet and on the medial side, right on the side of that great toe for both sides and right superior to it. Mostly just dry skin, even some calluses on this left foot right underneath the toes and on the toes. Same here, some on the toes and right underneath the toes. Feels good. There is some erythematous here, right on the heel of the foot and also on the heel of the foot and right on the posterior part of the ankle. She also does have a callus on this right foot that is erythematous and just dry. Just gonna look in between the toes. There are some particles between the toes on both feet, and it looks like there is some dried skin, but no signs of infection or any fungus. The last thing I'm going to do is I'm just going to do a capillary refill check. So it was refill under 3 seconds on the toes, except for the pinkies. They are very, very, very small, the nail, and most of them are callous, so it's hard to check. And it was also very hard to see anything on this toe here. No, it was under 3. Okay, so we have completed the assessment. So your circulation, your abdominal muscles are all good. There was a little bit of tougher tissue on the abdominal muscles, but I don't think it's anything to be concerned about. You can always talk to your doctor if you need to. Did you have any questions?
Nope.
Okay, this concludes my skills test 2.